Today, I'm talking to Lauren Settle. Lauren manages Advita Health's Chapel Hill location and has a background in health systems management and a passion for patient centered care. Lauren recently earned her master's in health administration while working full time in healthcare, balancing research, operations, and leadership development along the way. She's all about building strong internal culture to better serve patients and lead the way with clarity and empathy. Lauren, welcome to the pod.
Hey, Trip. Thanks for having me. I'm excited to be here.
Yes, I'm very excited to talk to you today. So let's just get into a little bit of your background. What got you interested in healthcare?
Well, I saw gaps in the healthcare system, whether that was accessibility, patient education, or policy, and I really wanted to be a part of the solution. I came into college thinking I wanted to be more on the clinical side, and as I saw, these gaps in the healthcare system, I came across my health systems management major, which was more business side focused, which I felt like I could have maybe more of a influence on. And of course, I believe healthcare is a fundamental right. So I just wanted to be able to contribute to making it better and more equitable.
So I guess I'm interested in the more systemic approach versus being a direct practitioner.
Yeah, exactly.
Well, I'm really curious because as a, I guess, self-taught healthcare entrepreneur, I'm really interested in like what you learned in school and how that's kind of translated into your work now. Is there a lot of overlap or not a ton?
Yeah, I mean, I would say a lot of what I learned is kind of finally put into practice now. So I'm able to explore it a little bit more in depth now, and everything I studied and kind of the different scenarios and situations we would go over in class. I'm able to kind of put what I learned to the test and see how I respond, but also take our values and culture and implement it in a way that's a little bit different and catered more towards what AIM focuses to do.
And tell me a little bit more about like just the MHA in general. What kind of things were you exposed to, and then what were you interested in after getting your degree? Like, did you know what you wanted to do?
Yeah, I always knew I wanted to continue my education, and we had a early entry graduate school program. So in my senior year of undergrad, I thought, what better opportunity than just to get started early? So then once I graduated from undergrad, I just had 1 year extra. So it was kind of a no-brainer for me just to go ahead and get started with it. But I wanted a higher education, wanted to be a little bit more competitive in the workforce. So just wanted to get it under my belt. And as far as the program, I don't have anything but good things to say about it. It taught me a lot. We were able to kind of explore a lot of different sectors of the healthcare field, which I really appreciated. I mean, now being in my role, I wish there were certain parts that maybe were explored a little deeper, but for it being such a broad program and healthcare being so broad, it was really nice to take those couple years to explore where my skills can be best suited. And so the operations side and management side really spiked my interest. Also, research and policy I really liked as well. So they overlap for sure. But like I said, it's kind of everything being put to the test now and knowing how to act in these situations based on what I've learned.
Well, and what did most people, I don't know if you have a lot of relationships from your master's program, but what type of jobs did most people end up getting? Were they big systems jobs or what?
So, based on LinkedIn, what it looks like is a lot of people have different coordinator roles. So, whether that's like injury and prevention coordinator, patient care coordinator, we had a couple people do fellowships, which is something that I definitely considered and thought of, but I really just wanted to dive straight into it and just get started and establish myself with my career. But it does look like a lot of people took more of like either a management route to start or a coordinator role to start.
And those coordinator roles, like mostly in larger healthcare systems, I'm imagining.
Yeah, so there's a few that are in some smaller practices, and then some people that went into the hospital, which is something that I really thought getting my master's, I was going to just immediately go to a big hospital. I moved from Charlotte to Raleigh, so I was thinking all the big hospitals like Duke, Wake Med, all of those. And I really just assumed because people had told me, you're going to be in a big hospital, you get your MHA, you're going to go off and be an executive in a healthcare hospital setting. And so that was kind of something that I had ingrained in my head. And as I started applying for jobs and interviewing more, and then especially when I came across AIM, I really kind of reevaluated my intentions and understood a little bit more the importance of having those intimate, smaller connections with maybe a company that's not as big as a large healthcare corporation, but could give me a lot more opportunity for that continual education and growth. And that was something that I knew from the get go that AIM was going to be able to provide. So it's held a lot more value than just being in a big name hospital.
Well, it's been awesome to have you on the team. I think I don't know if I shared this with you yet, but I was very concerned when you were going through the interview process. We had one person come with an MHA and it wasn't a good fit for the organization. And I think one of the challenges we often have is we've got these really big vision of what we want to accomplish and that impact that we want to have both on the policy side and how that shows up in higher quality, more accessible and more affordable care. But then at the end of the day, you were running the front desk for the first few months and learning just about everything from patient scheduling to billing insurance. And I'm guessing that's some of the stuff you didn't get exposure to in your master's program.
Yeah, so I mean, I worked full time while getting my master's, and that was part of my previous role. However, yes, coming in as the new office manager for Chapel Hill, it wasn't something that I thought I was going to be doing every day at the start. Needless to say, there's sacrifices you have to make to get to that next level, and especially opening up a new practice when you're the only administrative person here. That's just kind of part of what you have to do. And if you have that motivation and grit to just kind of get through it, then it makes it worth it. So there's no regrets or nothing that was too surprising. I knew that there was going to be some sacrifices along the way, but it's so important to kind of get that exposure to all sides of the healthcare system before you move up as it is. So I'm actually really thankful for it because I was able to pay attention to a lot of the detail, a lot of the behind the scenes stuff that now I can easily train our new front desk with and other people coming in and feel confident and comfortable to do so.
I think it's one of the sometimes the downfalls of folks who go straight from undergrad to master's programs, whether that's in a clinical route or in a non-clinical route. But you learn things at a higher layer of abstraction when you're, in grad school. You don't learn
Yeah,
about what CPT codes we're billing, X, Y, and Z. That's like very subject matter expert, revenue cycle
right.
management type stuff. But I think one of the advantages is over the course of your career that you'll actually have a in-depth understanding of what people on the ground are challenged with, and like when we're rolling out a new process or a new policy, how that's going to affect everyone, whether that's our patients, our providers, or that support team. So, from my experience over the last, I guess, 7.5 years now, one of the things that's been super helpful as we've gotten bigger was I used to know all of our, patients and their families when we only had 20 patients at a time. And now that we've got whatever 3,000, I'm obviously not involved in that, but I do feel like I can be helpful in solving some of the problems, on the ground because of that, background doing it.
Yeah, 100%. And ideally down the road, as things progress, I think it'll be amazing to look back and be like, I know so many sides of this. I understand so much of it. I'm able to kind of, yeah, contribute with new ideas, taking that into consideration. So it's extremely valuable, and everybody has an important seat at the table. So it's a role that we need, and that's just crucial to the success here. So I'm happy to contribute to it.
What's been the most challenging part of working here? And be candid.
Absolutely. I mean, a couple things. There's by far so many positives to outweigh them, but I would say, with being at the front desk at first, kind of just having to wear multiple hats at once, being the only administrative person over here for a few months from August to January. So went by fairly quickly, but on the day today, there were some stressors for sure. So I think just wearing those multiple hats and having to cater to a bunch of different needs, which is just kind of the part of being a manager. But with that also comes having some conversations that you might not want to have, or confrontation, or holding people accountable into the standards that you set before they came in, into the standards of the organization. And so it's not always going to be, just rainbows and sunshine every day. There's going to be times when you're really going to have to crack down and do it in a way that's radically candor as we do here. And so being able to have that firm conversation while taking, an empathetic approach and giving them that constructive feedback that will really benefit them more in the future than not. I'm really big on making sure, everyone's on the same page, and I don't want you to feel blindsided. So I want to give you that feedback along the way, and I want to receive feedback too. So what
How
can we
did
do as
how did you learn to do this so well at such a young age? Seriously.
A couple of things for sure. I think that maybe the candor side, the more like empathetic side, really just came from how I was raised. I had two really amazing parents that have allowed me to be super empathetic and show that side of myself and embrace it and be understanding of people from different walks of life. And the whole thing of kind of do unto others as you would want them to do to you, of course, which is kind of just like the Southern approach to it. But my master's program as well, I think just that level of professionalism that it gave me, I'm typically pretty cool, calm, and collected. And so I'm going to enter every conversation with that mindset and attitude. I want it to be productive. Everything we do, I want to be productive. And that's not going to happen if, clear and concise with what we're saying. And so I think that I just learned that from having the right influences around and immersing myself in my MHA program, asking those questions and kind of facing challenges head on. It wasn't always this way. I used to shy away from conflict and kind of get walked on quite a bit. And so I think that it also gets to a point where, you're either going to let that happen the rest of your life or you're going to make a change. And, in doing so, you can do it the right way and make it for the better in everybody in the situation. So just learning along the way, honestly.
Absolutely. And I think you were part of a Radical Candor book club too, weren't you?
I was. And so, I mean, the little thing, even the little things like that around here, like they really do make a difference. And I pick up on those things. They're important to me and they're part of our values. And so, even though it was just a book club, like I learned a lot from it. And I really enjoyed reading that book and kind of taking away a lot of different stuff from it because it challenged things that I knew that I needed to work on too when it came to conflict. And, in a situation like this, I was able to put it to the test pretty soon after.
Awesome. Well, what would you do you have any either advice or for someone who's maybe knows that they want to be in the helping professions or maybe specifically healthcare and they're not sure if they want to go that clinical route or that more operational administrative route, what would you say to them?
I would really encourage you to find a mentor, find someone that you can really talk to about your dreams and aspirations around healthcare outside of a family member. It could be a family member, but finding someone that maybe is doing that currently, doing a role that you're interested in, and through internships or going through to those career fairs, I think that it's super important. It can seem redundant as a student to feel like you have to continuously do those things, but they're set in place for you to set you up for success. So really utilize them, get that hands-on experience, explore the different sectors. I mean, there's so many in healthcare, of course, on a clinical side, but when you look at the non-clinical side, I mean, the possibilities are truly endless. So you don't have to sacrifice too much of your passions just to try to make it work. I would just encourage people not to settle. I was interviewing a lot throughout this process, and there was just nowhere I was really truly connecting with, and it was something that I had kind of just accepted that, oh, well, like your dream job's never your first job. And then I came across AIM and everything kind of changed. And I knew that that was my sign to not settle. And like I had finally found the spot that I was meant to be. And then the only other piece of advice I'd probably give is just to stay on top of the industry trends. Right now, AI is huge and it's only going to continue to become bigger. And it's ironic because in school, they tell you to stray away from using AI. You'll get in trouble. All this stuff. And so I was so nervous. And then I come here and they're like, have you ever used AI? Have you created an account? And I was like, no. So utilize it, try it out. Because I mean, it's something that you're going to end up using. So find a way to make it work for you and keep up with the trends. It's smart.
That's interesting. I didn't know we were going to get into the AI piece, but what are you using AI for the most in your day-to-day work right now?
I think when I've created some policies and procedures, I've asked it to kind of write me up a plan based on this document, and I'll attach a document to it of maybe a previous policy or whatever that we have, so it can take some of that information in. Or at first, I was kind of just using it more for the formatting because I was still
Mm-hmm.
a little bit nervous to use it for the content.
Mm-hmm.
And finally kind of started using it and then editing it a little bit to fit Advaita a little bit more. It ended up, being really helpful and saving a lot of time, which is, the most important thing, like what's most effective and efficient. And it's kind of allowed me to have the best of both worlds and learn.
Awesome.
It's not doing it for me. I'm really learning along the way too, for sure.
Yeah, I'm always shocked at how few people even scratch the surface on what they can do with ChatGPT or Claude or something. And I spend the most of my day interacting with ChatGPT and then, putting it in an actual document or an email. So I'm glad you've already picked up on that. It's going to save you thousands of hours in the next few years.
Yeah,
What
absolutely.
as now that you're getting your head above water outside of kind of the front desk administrative role, what are you most excited about, as you look ahead the next few months?
Well, as you know a little bit, maybe not everybody listening, but I'm really interested in the operation side of it. So anything data driven, I've already contributed to helping create some new reports in the system we use in the database. And so continuing to do that and just really honing in on that data so we can make important decisions for the future is something that I want to continue to contribute to. It might just look like a number, but there's so much that that number tells. And so being able to interpret it in new ways and kind of, well, from this, how can we move to A, then B, then C? And so the possibilities are really endless around that. So I definitely want to deep dive a little bit more into the operation side of everything and get more connected with our clinical and medical team, which I've already started to do, but just being connected to each department is also really important to me because I think that that also broadens my perspective quite a bit to other possibilities and decisions we can make moving forward for everybody, not just administratively.
And talk a little bit more about some of the reports, either the report, I know you were working on a big report with Nick and Alp, but I'd love to hear from your perspective how we are trying to incorporate more data-driven decision making and maybe just talk about this, one example a little bit.
Yeah, so essentially in the system that we use, we have a lot of separate reports that give us some valuable information, but we're constantly having to go to different reports to get the same types of things. And so we just thought it would be helpful to have one report that has all the information there, kind of just like a table almost for each provider that we have. So we can look at things like their utilization, how many follow ups they have scheduled, the number of patients without a follow up, looking at things like cancellation rates. So are patients canceling more? Is the office canceling more? Providers canceling more? Just kind of going a little bit more into detail of what we already have so we can kind of decide how to better the patient experience or how to cater more towards the needs of our providers or where are we lacking here? What can we provide? Is it more on like a medical or clinical standpoint or on an administrative side that we can support more? So we take that types of information to our weekly medical scrum meetings and our weekly clinical scrum meetings. Everybody has access to it. So we're able to kind of collaborate and hear their feedback as well of how we can kind of continue to expand that report.
Awesome. Well, anything else in terms of your work here or what you're excited about in the future?
Yeah, I mean, I am extremely open minded, and I would really encourage everyone listening to be. The healthcare field is ever changing, and it's always growing, and we need to grow with it. And so I think that that's actually a wonderful opportunity. And so just take advantage of it. Get connected. Don't be afraid to ask questions. Continue to stay curious. And get connected to those people that you admire and find your mentor. I just really, really encourage that. It's made all the difference in my experience. And I had really high expectations coming in, but they've just been blown out of the water. So it makes me extremely optimistic for the future.
Awesome. Well, if you want to turn the tables, what questions you're going to put me on the hot seat?
Yeah, of course. It's only right. Well, to start, it's a broad one, but I just want to know, obviously having the title CEO attached to your name is huge. So I just want to know, what does that really mean to you?
It means a lot more than it did in the beginning because in the beginning, I mean, there was a time I think I was the CEO of a 5-person company, and at that point, you feel kind of silly with a CEO title. But at the highest level, I'm probably going to forget off the top of my head, but I think of it in kind of core functions and I'm responsible for our overall brand and communicating that brand. I'm responsible for our culture, or at least leading by example and doing things that will curate the culture that we want to have. I'm responsible for making sure that decisions happen. One of the biggest things for me is like I don't want to hold anyone up personally, and I don't want managers to hold up people that they're managing from making decisions. Overall performance is obviously a big component of that, just in general. Like I have to worry about the performance, I don't view it as departments really. I just see the whole thing. So I have to make sure that when, the clinical department or the medical department wants to make a change, that that's in sync with revenue cycle management, that finance is in sync with revenue cycle management. So it's a lot of just kind of seeing the big picture. And for me, so much of it is really just trying to build the right team. So in addition to kind of the culture, brand, decision making, and overall performance, I'd say recruiting and keeping a really high quality team around is kind of where most of my focus is. But it's kind of funny because I forget that I am in charge, or that when I say something maybe haphazardly or flippantly, that my words kind of carry a lot of weight. So I have to make sure that I'm always showing up the right way, which is always a learning process.
Yeah. And kind of going off that learning process, here we have mentors or we have supervisors and people we can look to. So, who do you look to or where do you look to gather that inspiration and that continuous motivation so you can feel fulfilled as well?
Chat GPT. So I think mentorship's huge. It was cool to hear you talk about that. That's not something we've talked about in passing, like the importance of mentors, but it's something I really encourage everyone to have a mentor. I generally encourage people here to obviously, build a good relationship with your supervisor, but I think there's a lot of value in having mentorship outside the company as well. And I think of mentorship actually in kind of three different buckets. You've got like your mentors that you learn from that have a lot more experience than you. You should also be in some sort of peer type group so that you can just commiserate over the challenges that you have in a certain role and hear how they're approaching things at a different organization. And then I also think it's actually really important as you get older, so maybe 10 years from now for you to have, someone who's younger who you may be serving as their mentor, but that you're also actually learning how the next generation thinks. One of my older mentors dubbed me his like junior mentor, meaning that I was the guy telling him how millennials think. And I've taken that with me, and I think it's really important.
Yeah, absolutely. With that too, we were talking about my MHA in school a little bit. What's a topic that you wish schools would focus on a little bit more when it came to healthcare or just like being in the business?
Okay, so I did not apply myself through undergrad. I went to law school and left to start Greenhelm. So I don't have a ton of solid academic background to draw from, but there are a few things I wish schools covered more broadly. And one is just I was an econ major and I've become more interested in economics. But economics is really just the study of scarcity, and that we have to make trade-offs. Every decision comes with trade-offs, and every minute of the day we are doing one thing at the exclusion of everything else we could possibly be doing. And I don't think most people get any training in how to think through decision making. So the idea that with every decision come trade-offs, and we just need to be, we need to be clear about when we're making those decisions, what those trade-offs will be. From a clinical perspective, especially in the behavioral health side. So I think problem solving in general, that's like number one, is the biggest bucket, is how to go through a deliberate problem solving process, even if it's just in your own head. And part of that is knowing your trade-offs. And I would say another thing that surprises me, that we have so many clinicians who don't get more of a philosophical orientation to what it means to be a human, like the theory of mind. So a lot of times you learn these specific interventions or how to work with certain conditions, but you don't necessarily have a broader view of the world, what it means to be a healthy, flourishing individual. And from the theory of the mind perspective, I could go in like my contemplative rant, but I'll try and avoid that. But I think it's just really important to understand your own mind and have tools that you're using to continue to learn. So I think as the world and technological change speeds up, school isn't going to be a one-time event. I think 10 years from now, everyone's going to be doing more on-the-job learning. Maybe people are even going back to school every 10 years because they have to get a refresher on what's going on in the world and what
Yeah.
tools are out there. I worry a lot about the future, but that's not the question. How to think and how to be a lifelong learner. I just don't think school actually prepares you a lot of times on how to be successful in the real world.
Yeah, no, I would have to agree. I know a few weeks ago we had a similar conversation about, you mentioned the idea of trade-offs and like what that looks like and what that means, and gave some examples. And since then, that's kind of stuck with me. I always think about what's the trade-off in this situation or this one. And I think that, we live in a society that's pretty indecisive. And so having that fundamental understanding of who's going to step to the plate and make the decision, or how do I gain that confidence and feel empowered to make things happen. And so at this point, for people that might not be in school, or that's something that they're not as interested in, at least find an organization or people in your organization that are willing to kind of invest in you, and you can invest in them so you can learn and feel empowered to make decisions to make things happen. So totally agree, and wish some of that more like foundational work was taught as well. Do you feel like you have any big challenges currently that you're trying to overcome?
Personally, always. No, I think what I would say as at work as the CEO, I feel like we're just at a pretty big inflection point where in the past, a lot of the challenges we're having now come from the fact that we operate as, really one cohesive team, which sounds good. But what it means is, unlike a larger system where you may have more of a corporate overhead, or you may have people who are kind of just dedicated to making and managing policies and procedures, that we often have to draw the lines and also color inside them. And so I think what that means is we have a lot of things that are work in progress, and that's true across the entire organization. So sometimes there's a little bit more chaos. There's like, who's making this decision? It's not always going through as deliberate of a process as it should. I'm also very paranoid about being too bureaucratic. So I want to make sure that we're able to make decisions at the lowest level possible. But one of the things that's sometimes challenging, I think, is when I don't know who's an expert, or, just because you're in a role doesn't necessarily mean that you're the best person to write the policy. So just because you're the clinical director or the medical director, maybe that doesn't mean that you should write the policy. Maybe it means you need to edit the policy, or you need to fill in some of these specifics. But even like in your role, you've got a pretty great understanding of the different trade-offs. Again, like if we make the policy, if we change the no-show policy, how does that affect patients? How does it affect providers? So all of these decisions, there again, it's just always trade-offs. And I think like with our team, sometimes like we haven't fully published all the information or how to think about it. So we end up with people doing their best to make decisions or to create a new process or policy, but they're not necessarily considering everything that they should. And a lot of that just comes from time and experience. So I think that's the biggest challenge now is everyone works really hard. I kind of feel like we work harder than most of our peers in practices like ours. And I think we've got a really great, like, intellectually capable team, but sometimes it feels like everything's harder than it should be. So I hope that over the coming months that some of that kind of smooths out a little bit.
Yeah, absolutely. I think a lot of that's just, there's tons of passion behind what we do. And so I think at times we think a little bit more like hone into something specific, when sometimes we just need to take a step back and look at it more from a broad perspective. That's something
Mm-hmm.
that Nick and I have talked about a little bit even too, where we both like sometimes look really in depth at like one problem, but like he's mentioned to me before that you've really helped him be able to say, okay, like let's pause. What's going on like around us? What's contributing to the and how can we look at it more from an outside perspective or a step by step instead of just this one thing.
Yeah.
And so, yeah, totally agree. I guess my last question for you today, I just want to know, as you know, someone that's recently come out of grad school and still aspiring to be something big in the healthcare world one day, what advice would you give to healthcare professionals or people that are considering taking this route?
I think I'd just echo the advice you gave, which is mostly find a good mentor or set of mentors and be committed to continuously learning. I think also, looking at your career over a longer time horizon and just working on your own narrative, not just the story that you're telling as you're out in the job market or looking for a new role, but the story that you're telling to yourself. And why did I take this position? What am I going to get out of it? One of the things I always talk about for our organization is I want us to be deliberately developmental, which means that I want to make sure that I know Lauren's goals so that I can incorporate her goals and her development into the organization. And I think the best way to do that is to have mentors because they've already had some of the same challenges and struggles that you may run across and help you navigate those situations. And then just the commitment to learning. I personally think everyone should read a lot more than they do. But whether it's reading or online courses, videos, chat GPT, you can learn a lot on your own. So I think just being proactive. One of the other things I always say is you want to do a good job balancing the time that you're really head down. So for someone like like you want to like do a really good job day to day. But then every now and then you need to like pick your head up and look around, whether that means in the entire kind of job market industry or whether it just means let me like pick my head up and look around internally. Am I on the track that I want to be? Make sure that you know what you want and then tell people what you want because a lot of times like that's the missing piece is that we don't have clarity about what we want or need next. And if we could articulate that, then we would all of a sudden, the people who can help us get there will appear. So
Yeah.
balancing just doing your day to day thing and doing it really well, and then looking up and scanning.
Yeah, absolutely. I love that. Don't settle. The right seat is waiting for you. It's not always going to find you, so go find it.
Yeah.
Absolutely. Well,
Any
that's what I
closing?
do.
Yeah.
As far as some closing thoughts, I just wanted to thanks for having me on. I've actually always wanted to start my own podcast. I've always wanted to be on a podcast, so this is so fun for me.
Well, maybe you'll have to start another one here under the Advita Health banner.
Yeah, I might just have to add it to the goals list.
Awesome. Well, thank you, Lauren. See you
Thanks.
later.
I appreciate it.